Hey everybody, so I hope everyone's doing all right with all the rain out there. In today's video I wanted to talk to you real quick about posture. So a common posture that I see in the clinic a lot, and it can cause back pain, and it can throw off a hip. It can even cause foot pain, which seems a little bit of a stretch, but it can, especially when people are in quarantine and doing all types of maybe different exercise or running, just changing up their exercise routine. So the posture that I see is people's rib cage will be flared forward, and then their pelvis will be tipped forward as well. So I'm exaggerating here, but people will be tipped forward like this. And a lot of times people will live in that position. So in the past, I've had people tip their pelvis down to try to correct for it, but then usually what happens is they're tipped forward too far, and they'll come back in their next visit, and they have what I call the old man walk, which is kind of too far in the other direction. So the tip I have people do is, instead of trying to correct it standing, I like to have people do it sitting. It's usually easier to start there. So if you're already kind of tipped forward almost too much, one thing that you can do is to find that good position for your back and to help bring your rib cage down is if you go all the way into a slouch, just over exaggerate it, and then if you go really far forward where you get a little bit of tension in your back, and then you want to back off of that just a little bit so that that tension goes away, and that's usually your ideal position. That's usually a good place to start. It might feel really weird to be there, and it might feel really weird to keep it that way. But usually with a little bit of practice, you can get used to it. The other thing is you might have mechanical restrictions. So you might have some tight joints, you might have some tight muscles, maybe some tightness in the nerve where you're not able to get to that position. And we see that a lot in the clinic. So if that is the case, give me a call, and we can take a look and get you going on a couple different specific exercises that can help to alleviate that and get you into that better position, get you into that better posture. That's all for now, and hope you all are doing okay. Take care. Bye-bye.